Hi, my name is Chavela Brown. I am a nurse at University Medical Center in Lubbock, Texas, and I'll be talking about our poster, The Return of Syphilis. Are we doing enough to aid in the prevention of its spread? Based on the CDC Centers of Disease Control and Prevention, prompted an appropriate treatment of patients diagnosed with syphilis is important through screening. Here in our county, we serve several small counties throughout in University Medical Center. And we have seen an incredible increase in our syphilis cases here. Normally, when we're conducting surveillance and chart audits, I see 592 sexually transmitted infections, which include gonorrhea, syphilis, and chlamydia, with syphilis being 155 of those cases. A lot of those patients do come into our emergency center, and they often get discharged before they're treated or they leave AMA against medical advice. So we tried to figure out what we can do to make sure that we get those patients treated before they leave. As we did our review of literature, we found out that we are not the only ones that are having this type of issue. That over the last decade, there has been an increase of syphilis throughout the United States. But here in Lubbock County, like I said, which encompasses several small towns and counties around us, we have seen a steady increase, an increase over when we did this poster, 500%. And here recently, we've been told we're over 600% compared from 2019 to 2023. So with that increase in numbers, we know that early treatment is imperative. And so what we have decided to do is how do we get these patients treated? A lot of our providers thought we needed to wait for the RPR to come back. And we push not to wait for the RPR, but to go ahead and treat if we get a reactive screen. Like I said, it is often difficult to get these patients either back into the hospital or get treated at the health department when they leave. In our background, like I said, we see an increasing number specifically of syphilis because of multifactorial reasoning. It's high risk behaviors, a decreased fear in contracting AIDS, declining use of condoms among adults and adolescents, and a decline of public health prevention services. And that was really seen during COVID. More was focused on them. And there was also a decline in the use of our testing supplies that were used, allocated for COVID. So appropriate assessment, testing, and early intervention is really, really important. Otherwise, those patients will fall through the crack and we continue with the spread. Some of the methods that we use, our infection prevention and control department is notified of every syphilis case that does come into the hospital, whether it's inpatient or outpatient. Those patients are followed to make sure that they are getting treated. If they're inpatient, a note is sent to each provider to let them know that this patient is treated, and based on CDC guidance, guidance from our health department and our medical director, we recommend that treatment be given to these patients. And then once that chart audit is finished, we send it off to the health department and work in conjunction with them to make sure the patient is treated, or if need be, they come back into the hospital. We also have an urgent care clinic now that will screen our patients and will treat if needed. They can come back in to be seen. As you can see in our results, we see quite a few patients. Our data was limited, like I said, based on our testing supplies available due to the COVID pandemic. And then following our consultation and collaboration with our medical director of the EC, we are able to increase our amount of patients that we are treating outpatient-wise through our urgent care and having them come back in. That's really helped. Our conclusion is appropriate assessment and testing and early intervention based on related symptoms and risk factors help us fall in line not only with CDC guidance, but it also keeps hopefully decrease the number of syphilis we see throughout Lubbock County. Hasn't started working as of yet. And as healthcare providers, it is our responsibility to remain current with our evidence-based practice in CDC guidelines and recommendations. We are seeing some difficulty with obtaining penicillin. And so it has been even more important that we appropriately take those steps that we need to prevent the spread of a curable disease. And our impact to nursing was we had a lot of nurses that are unfamiliar with treatment options for their syphilis patients, and really understanding the different types of syphilis, the different stages, and providing appropriate education to their patients and partners, and then barriers, finding appropriate resources to manage care for patients that may have neurosyphilis or oculosyphilis that need IV therapy. Finding that continuous care is really difficult here. And then requiring the longer lengths of stay with increased morbidities and mortality. We do see quite a few patients that come in that did not know they were positive, especially our older population that come in with neurosyphilis or ocular syphilis that have to stay in the hospital up to 14 days for treatment. It's really interesting to see that we are still seeing an increase in number of patients that come in with syphilis. So we continue to work on this. We are getting more buy-in from our providers by sending the communication letter of having them treat our patients. And then the urgent care plays a really important role in getting those patients treated before they are discharged. So we will continue to work on this. I think it's going to be an ongoing issue, and hopefully we can start to see a decrease instead of an increase in syphilis in our population. Thank you.